with using Botox or fillers, and how do I go overboard with using Botox and fillers? I think this is a very complicated and potentially complex question, and I think it can be best broken down into two components. So the first component is, how do Botox and fillers work, and what do they actually treat? So Botox treats fine lines and wrinkles by decreasing the muscle activity that causes these fine lines and wrinkles. When used appropriately, what the Botox does is it relaxes the muscle enough that the wrinkles that occur from muscle contractions are not seen when the muscle is not moving. You should still be able to make an expression when using Botox. When someone is injecting you appropriately with Botox, you should still be able to make the expressions that you normally use, just at a slighter degree or a much decreased degree. You should not be completely frozen when you cannot make any expression at all. With regards to fillers are mostly used to replace the volume loss that happens along the bone and also along the supporting structures of the face as we age. If too much filler is used, or when the filler is not injected into the appropriate areas to give back the right amount of volume, you can have facial features that are accentuated, that are out of harmony with the rest of the proportions of the face. And that's one way of going overboard with fillers. Sometimes people do want to do transformations of the face using fillers, and that can certainly be done. But again, the key is to make sure that the filler is injected in the appropriate amount and in the appropriate area so that the final result does not look out of proportion to what already exists as facial features for the patient. Everybody has their own goals of treatment. So when you as a patient go in to see a healthcare professional that's offering Botox and filler services, they should have a very clear discussion with you about what your goals are. They should give you some very realistic expectations, because sometimes the goals are not aligned appropriately with the benefits from the procedure. Because Botox injections and filler injections are medical procedures that carry with them a certain degree of risk. Your healthcare professional who is providing you these services needs to have an adequate discussion with you about the benefits of the procedure, about the risks of the procedure, and whether the benefits outweigh the risks in your case to accomplish the goals that you have. And also, everyone is different. Everyone has unique features. Everyone has unique properties with their face. And your unique features are what makes you you. Like, everybody has a fun feature that they like about themselves. And you should, whatever you decide and whatever your goals are, at least try to preserve the features that you like the most about yourself. And these are things that you should always discuss with your healthcare professional. And an experienced and professional medical aesthetics injector would take the time to discuss that with you during their consultation.